Buenos días, señoras y señores. Unfortunately, this is it from my Spanish, so I have to switch to English. Hopefully somebody can translate for you my English. Thank you for invitation to the Mexico City. I've never been in Mexico City. I've been in Yucatan, in your fabulous country, for vacation. Now first time as a presenter. And I hope I can give you some practical information about the peptides, about the combination of peptides and other therapies, how we do it in Prague, in our clinic, and how we develop it from 2009 till these days. Let's start. Because of the time, I will skip maybe 20 slides and go directly to the indications. And if you have time enough, then you can come back to the theory and the history. But I'm sure that many of you already knows what's going on and why we use it. So let me check. Okay. I'm very glad that as the first speaker was Professor Tai, who definitely approach how we should in medicine work with the patient. Then this should be definitely the, oops. Okay. I want to go back a little bit. Okay. So let's start with how the peptide therapy should work. After the administration, either by injection, we do the either sub-Q injection or intramuscular injection, or even intra-articular injection if it's necessary, if we deal with the joint disease. Or we do the sublingual application, but only with 10 kilodaltons peptides. If it's bigger than 25 kilodaltons, it doesn't make any sense because it will not penetrate the mucosa. So be careful if you deal with peptides and you buy some products. Well, then, of course, when we dissolve it, when the organism gets it, then the process of regeneration is initiated. The process is possibly based on so-called homing effect, as maybe you know, the Professor Nihans and Professor Schmidt already established 50, 70 years ago. When we work with the patient, we try to follow this holistic concept of therapy. We made the chart, which I give to all the patients, of course, the empty. Just left part is prescribed. On the right side, the patients usually write what he would like to follow in such a level. And I strongly believe that if we will follow just the material level as our school medicine follows, then we cannot get the people up from the pathology which we are seeing every day or around us. So as you can see, on the material level, definitely the peptide as an ultrafiltrates or let's say 300 kilodaltons, they are on the place. But of course, together with nutrition, orthomolecular medicine, physiotherapy, and so and so. There is an energetical level when the traditional Chinese medicine is belonging, or high-dose vitamin C, or vitamin D, or application of ozone, and of course, again, peptides, ultrafiltrates, or peptides intramuscularly. Then is the informational level where homeopathy or autopathy or bioresonance belongs. And of course, again, if you work with small peptides, dipeptides or quadrupeptides, like, for example, Professor Havinson is working in Russia, then definitely you enter this informational level and you touch the epigenetic level of the treatment. And of course, above that, it's always emotional, mental, and spiritual or supramental level of treatment, which, by my opinion, are the most important. Just for information, we use to point the diagnostic bioresonance device called Imago 530. In Europe, there are two main systems, either Imago or Bicom, the German machine, German device. Probably you know about it. At the moment, as I know, this device already got the approval from the FDA, so probably it will be available in American market as well. We use it for more than 8 years now. It has also the therapeutical mode, not only the diagnostic mode, but we use mostly the diagnostic mode. So, the question is when and where is the best time to use a subcell peptide-based therapy? Generally, it's for everyone, but let's say for someone who is not feeling well for a longer time. Generally speaking, it's for everyone who reached the age of 40 and lives in such busy city like Mexico City or Prague or whatever in Europe, where the pollution, the quality of food, and so it's not really good. Then, of course, for the people who don't have particular diagnosis, just don't feel well. The people with so-called adrenal fatigue, which is maybe more than 80% of us because of chronic stress. And of course, for the people who cross the age of 50, all of these people are good candidates for so-called total revitalization. Again, we stress that we always have to work in combination with either homeopathy, as Professor Tai mentioned in his presentation, with phytotherapy, with orthomolecular methods, microelements, microtraces, ozone applications, psychosomatic medicine, nutrition. Without nutrition, without hormonal balance, the peptides are for nothing. So we have to go step by step. It's not easy. It's not just apply sublingual or intramuscular peptides and wait for miracle. It will not happen. And of course, systemic enzyme substitution, it's another very big issue for this. So let's go for the main indication for the peptide-based therapy. As you can see there, I put it to maybe 8 major indications, but definitely it's more than 8. But let's start with first one, cardiac, circulatory, and vascular disease. We saw in our practice, which started working with peptides in 2008, so it's more than 11 years now, significant improvement in circulatory insufficiency of the heart, brain, peripheral circulation, definitely. We use it even after infarct of myocardium, but not immediately after acute infarct. No acute condition is good for peptide. Be careful. Then definitely it has very good influence on the blood pressure. And in some occasions, together with hormonal balance in migraine relief. I made a chart for you, so it's easy for you to remember and maybe take photographs. The diagnose and the main peptides combination and the second series and at the dosage. So if you want, you can shoot a photo, whatever you want. The main indication in our practice is arteriosclerosis, which we combine 300 kilodaltons peptides from artery, from placenta, from heart, and from liver. As a second series, followed probably 6 to 8 weeks after first one, it's gonads and connective tissue peptides. The dosage, if it's not written differently, it's 3 times a week, 5 weeks, 2 or 5 milliliter vials, or intramuscularly or subcutaneously, whatever. Some people say, oh, you use the animals for peptides. Of course, for example, Professor Havinson developed the artificial peptides, which are made in the lab. And then dipeptides or quadrupeptides. To be honest, I believe that in the organism, in the nature, everything works together in conjunction. So if you just isolate one peptide or 2 peptides, definitely there are the keystones. But without collateral peptides, they will work maybe half, maybe 10%. It's like in the football team. You can have Messi, you can have whatever famous players, but if there will be no 10 other players around him to work for him, then it's for nothing. The team will not be a good team. So come back to the ultrafiltrates. Many people tell us, we would like to go for peptide therapy, but we are vegans, we are vegetarians, so we don't want to take the animal products. We say, okay, so 11 years ago, we decide that maybe we can extract some either peptides or terpenes or polyphenols from the herbs or from the mushrooms. and then we can work with this. So we tried, and after quite a years of development, we came up with the products which are sublingually taken. It's drops. It's one ampulla per day for 2, for 3 months, for 4 months, then again with some break. And we name it in accordance to for which indication this product should be. It's easy to take for the patient, and to be honest, late 5 years, we see very big improvements, even with the 10 kilodalton sublingual. Here is some names, here is some products. Another big issue is gastrointestinal tract. In our European population, probably there is no single person who has no problem with the gastrointestinal tract. Why? Again, because of stress, because of pollution, because of food quality, because of water quality, and so, and so, and so. So we have to deal with it somehow. The conventional school medicine sometimes helps very much, but only on the material level. If we have to go to the energetic level, to the informational level, we have to do something else. And again, one of the possible approach is a peptide therapy. So there are some main indications for the gastrointestinal disorders. Chronic hepatitis, very good results. Cirrhosis of the liver, excellent results. Senile diabetes second type, excellent results. And very good result with Crohn's disease as well. Together, for example, in Crohn's disease, together with systemic enzymotherapy and the hormonal balance re-established. Again, the table for you with diagnose, with the main peptide combination, with the second series, and with the dosage. The dosage mainly is really the same. We try to make it as simple as possible for the doctors, and for ourselves, of course, because we do it every day in our practice in Prague. Just pointed diabetes mellitus. I was quite skeptical when we started with the diabetes treated with peptides, but especially with senile diabetes type 2, after 2 or 3 courses, it's not after 1 course, after 2 or 3 courses by 5 weeks, there are very significant improvements of the blood level. Another combination with 10 kilodaltons phyto products. Super adaptogen, as the name is telling, this is the combination of 8 different plants from all over the world. Every one has a kind of adaptogen influence on the body. I'm sure you know about the plants who are named super adaptogen. For example, rhodiola rosea. And okay, third big area of application is a joint disease and rheumatism, and generally locomotive system. People with chronic joint pain often really can feel the pain relief after 3 to 5 weeks after the application of the peptide extract, either the injectional or sublingual, or they can combine. For example, very often in our practice we combine xenopeptides intramuscularly or subcutaneously or even intraarticularly into the big joints with 10 kilodalton sublingually for 2-3 months. Again, the chart for you, just the main indication: osteoporosis, arthrosis, arthritis chronica. And you can see we use a lot of placenta, cartilago, and liver. And if it's necessary, also connective tissue. Okay, there is another chart with the phyto products with 10 kilodaltons. Another big area is hormonal and sexual problems. Here we can really help together with another therapies, as I mentioned before, for male and female menopause, for impaired sexual potency, for infertility, and with emotional problems, depression or burnout syndrome, which is actually part of adrenal fatigue. Another chart for you. The first one, adrenal insufficiency, is the main issue in Europe. I don't know here in America continent, but we have it very much. And hypothyroidism, as Professor Tait mentioned, it's a another issue. every second lady after 40 in Czech Republic, it's coming with hypothyroidism based on fatigue. Yeah, because we know that thyroid gland is not only producing these few hormones, but it's also kind of dispatching. It's like manager of energy transmission in the whole body. Yeah, so this is one of the main organs, especially for female, and we know that 20% of female in Czech Republic after 50, they don't have thyroid. They are after thyroidectomy. Okay, another chart for you. The same endocrinal help only with the plants extracts, then kilodalton, peptides, polyphenols, terpenes. Another big area is weakening of intellectual abilities and neurological disorders. Actually, this is kind of part of anti-aging. Basically, the whole peptide therapy is part of anti-aging, or better to say, well-aging, because we cannot really stop the aging. We can just manage the aging, so we are age gracefully and not so quickly and not so in pathological way. Okay, and here is some main indication. I'm sure you know all of them. And we follow, for the sclerosis multiplex, we follow this protocol together with the protocol of Professor Coimbra from Brazil, from Sao Paulo, maybe you know, with a high dose of vitamin D, and so and so and so. So we try to connect these two protocols, and we already have quite a few patients who are improved pretty much from very bad condition in sclerosis multiplex, mainly ladies. But as you know, it's mainly ladies' disease, unfortunately. Then we have quite good results with autism and with cerebral sclerosis as well. Okay. Here's another cognitive neuropsychiatric function can be improved. Let's say not cured, but improved, so the people can be really self-dependent. You know, if you have in the family somebody with Alzheimer, then the whole family is destroyed. The whole functioning family is destroyed. If we can help these people just to revitalize a little bit, just to come back with the memory, just to come back with basic functions, then the whole system in the family can work again. Yeah. And we use also combination the peptides from the xeno preparation and the plantar. Here is the list, some of them. And very big area, of course, is weakness of immunity system, which touches very, very big area of the disease. And I will point that especially combination of xeno preparation, which in the next slide will be shown, combination with so-called supramacian ultrafiltrates sublingually, which is combination of 14 different medicinal mushrooms combined in 10 kilodaltons. We've been working 4 years before we release this to be sure that there is no allergies and other stuff as well. This is very good to support, especially for the people who are undergoing the chemotherapy or radiotherapy. The blood count is stable. They are able to hold more chemotherapy, which, to be honest, is good or bad. It depends. But they can carry much more strong, let's say, material treatment together with mushrooms. Okay. So what we really can achieve after the application, of peptides intramuscularly or sublingually for immunity system, decrease the inflammatory responses, improve the tissue repair, improve the host defense to an infection, decrease the duration of the whole treatment, and of course improve the blood coagulation, microcirculation, and hemopoiesis. Again, there is a chart, and you can see even during such a heavy disease as a cancer, we can use peptides. But of course, this is not a first line. You should work with the peptides for quite a while, and then maybe enter the field of supportive medicine, supportive therapy for the cancer. But if you put a combination of thymus, of frontal brain, or placenta, male placenta, then you can really help the people with many, many disorders in the malignant disease as well. In leukemia, a combination of spleen, liver, and bone marrow is very fabulous. for the male after 50 in our region, there is a 40% of male they have problem with prostate, either the chronic prostatitis or prostatic adenoma. Again, very good combination of the 4 different proteins, or in the second shot, male revitalization, which I will touch later. It's very useful, very useful. And again, some combination of peptides, 10 kilodaltons from the plants or the mushrooms in combination will work even better for the patients. Skin disease, again, another big area. We can help in chronic eczema, in acne, in chronic allergy, alopecia androgenetica, which is, again, in our region, very big issue for the male. We have very nice combination for that as well. And I will point the placenta extract in topical gel form in aesthetic medicine. It's quite good, or even after the burns or after big surgeries to heal the scars better. So here you have, for example, for the alopecia, adrenal gland, diencephalon, and skin extract locally, or in the second series, skin, placenta, and the liver. Okay, and the combination with 10 kilodaltons. Oops, sorry. For example, the last one after surgery, we recommend for all our patients, for not only our patients, because it's already known in Czech Republic, these products, and the clinic, that if they use it 14 days or 20 days after surgery, the healing process really rapidly speed up. This edema, the swelling, the pain, the local signs, the movement after the joint operation, it's much quicker back. Okay? In the near future, we already prepared it. It's a gel form with transdermal carrier, nanotechnology. Phyto content will be Calendula officinalis and gentian root, 10 kilodaltons, and then plus xeno content of these 6 different peptides. Okay, and coming to the last portion, revitalization. Here on the chart you can see what kind of peptides it should be inside. Very useful. I very strongly recommend to all of us to take it at least once a year, 3 times a week, 5 weeks or 4 weeks, let's say, either intramuscularly or subcutaneously. No side effects, no adverse reactions if you do it properly from good source, and I'm sure now you can find good sources around. So, and after 60, let's say twice a year, between 50, 60, once a year, let's say. Okay, here is some protocol, how we do it in our clinic. Let's start at least in the 5th decades, every 1 or 2 years, but you can do it even every year. In severe cases, let's say beginning Alzheimer or some cognitive function losing twice a year, not more than 6 tissue mixture, because then it's too much for the body. Then the body must to deal with it. So it's better to do it step by step. 3-4 times per week, 2 weeks subcutaneously or intramuscularly. We combine it with high dose of vitamin B, with high dose of vitamin C intravenously, up to 7.5 grams, even 15 grams once a week or twice a week, and 10,000 of vitamin D3, 10,000 units daily, if it's not contraindicated, of course. And very important, coenzyme Q10, at least 200 milligrams per day. For us who are 50 plus, which I am, we should do it regularly. And the trace elements as well, of course. Orthomolecular medicine is the basic. Just to compare, there is some indications and recommendation from Professor Vladimir Khavinson, the Russian professor from St. Petersburg. He used a lot combination liver and vessel, which means artery or vein, and the thymus. Lately, we really like combination liver, vessel, and thymus. This is it seems this is like a holy triad of the peptides. I don't know why. Maybe something is changing in the whole physiognomy of the human being. But if you will work with the peptides, don't forget about this triangle: liver, vessel, and thymus. With this, you can help 80% of the people, regardless the diagnosis. Okay, now there's a very simple chart what kind of products we have available and we are working with, either ultrafiltrates, 10 kilodaltons, with ampoulas, sublingually. Of course, if you put it sublingually, you can put it even subcutaneously or intramuscularly or even intraarticularly. All I tried many times without any problems. Or you have, we call it in our clinic supercell, it's 300 kilodaltons. So if you put it sublingually, will not dissolve because it's too big molecules. So then you have to put it somehow differently, and it's better not to swallow as a capsule because you don't know what's happened in the stomach. You know, there are strong acids, so you have to cross over the stomach, the git. So either you put sublingually or intramuscularly, subcutaneously, then you'll have very good effect immediately. Well, not immediately, let's say 3 to 4 weeks after you finish your course, your patient should feel something, should feel improved. Of course, every method has some contraindication. Even the application of peptides, I mean intramuscular peptides or let's say parenteral peptides has a contraindication. Never do it in acute total infection or when is the florid local infection appearing, because you can worsen the effects or you can deny the effects of the peptides because the body will kill it, like the body, foreign body. Then, of course, with serious disruption of metabolism, like advanced diabetes mellitus or massive circulatory problems or low blood pressure, you have to be careful. Then, of course, with serious acute asthma, you have to be very careful. And then when severe psychotic and seizure diseases, you have to be careful with this. And generally, all acute conditions are contraindication. But after they disappear, then you may come with step-by-step peptide therapy. Practical use, what we do before, if there is sublingual application, then just I talk with the patient and ask like, as normal anamnesis. But if there is application of intramuscular or parenteral, then you have to take the examination more seriously because you never know what the patient does before. So I take complete anamnesis, including allergies. I take the blood count, the whole blood count, so I see how is the levels, and then you have to compare. Then you have the benchmark. What is the improvement, even for the patient later on, and of course immunostatus is recommended. So how is the application of so-called supercells intramuscularly, classical locality, musculus gluteus maximus, or you can do it subcutaneously. At the moment, I have a patient, my good friend. He's with amyotrophic lateral sclerosis, ALS, a former football player, very famous football player in Slovakia. At the moment, it's 4 years. He developed the disease. Regularly, we do the peptide therapy. So far, the disease is progressing, not so. He's able still to be with family, to enjoy the family. So we'll see. Please don't mix different products in one syringe, unless it is the already pre-prepared mixture. It's better to do 2 or 3 with three different locations. It's better. Adverse reactions, so far, after 10 kilodaltons and 300 kilodaltons, I never see any adverse reaction in almost 11 years of our history. Just be careful with application of placenta extracts because of the blood pressure. It really may decrease the blood pressure. So you can inject, the patient will walk out of the office and can collapse, and then will be on you. So better after, especially after placenta extracts, wait in the reception or whatever, better 15 minutes, and then it's okay, then they can leave. It's your protection. Okay? Some patient may experience some local redness with a few minutes, but then it's disappearing. After 300 kilodaltons, with some patient, more sensitive patients, even they can feel on the injection spot, maybe 1 or 2 days, some kind of sensitivity, but then it's disappearing. The only adverse reaction may happen with this one, you know, heavy anti-aging. So, what is our setup for our patient treatment? If possible, comfortable chair or bed, music, specially chosen to calm down the patient, we have in each room, we have the music. And according to the patient diagnosis and his progression, we choose the music. Then aromatherapy via diffuser. We choose for each special day regarding the Ayurveda different aroma. And then visual mode is switch on. We have special paintings or we have a video projection for the patients. Then application the peptides, and then we apply the reflex therapy or quantum entrainment, the technique. All this takes 15-20 minutes, so it will not hold you, but the patient, I'm sure, will happy to pay you maybe more money because it will be like not only just application, but enjoying the moment of the treatment as well. Okay, some basic recommendation: no nicotine, no alcohol, no sport, 1 day post intramuscular, not sublingual. Sublingual doesn't really matter. Yeah? And rest maybe for half an hour after intramuscular injection. And I recommend to my patient to eat on the day of application just light meal, possibly vegan, the day in application and then day after application. Some kind of bibliography which we are working with. And this is the wish which I would like we do, all of us. Thank you. Thank you.